One topic that barely got mentioned in that debate was the future of Social Security and Medicare. Those entitlement programs for older Americans make up the third rail of American politics. No politician wants to touch them for fear they won't get elected. But the current path is not sustainable. Retirees often receive much more in benefits than they pay in. The system increases benefits for future years, and fewer young people are entering the workforce to support it. So, Anirban, how can the system be reformed? Can it be reformed?
So we had talked about this before. Yes, the system is in crisis. And when I look at what economists say, and you know, there are a couple of things, right, that are said that it can save the system. One is to do it means testing, right? Second, increase payroll taxes above $168,000. Why is it capped at that particular point? Why shouldn't it be above it? And another thing is, and this is a little bit esoteric, that the adjustment for computing the increase in the Social Security benefits is based on the consumer price index, which rises at a faster rate, is not based on the consumer price index, I'm sorry, and it is based on the average wage levels, right, and which grows much faster than the consumer price index. So that adjustment could be done also, and then also increasing the retirement age. And these are the three solutions that are politically viable without, you know, turning off a large portion of the crowd.
Rick, could we see a freeze, let's say, in Social Security rises
for
just a couple of years?
There will be adjustments, and adjustments can be made. First of all, Social Security already is means tested in how initial benefits are already calculated. Right. There are bend points, and it gets, you know, we're not going to get down into the weeds of that unless you'd like to. More than happy to do that. But it's a third rail for a reason. The poverty rate of people 65 and over in this country is below 11%, much lower than the national average. It's been successful at improving the
and that was why it was initially created.
That's right.
To keep older Americans out of
and there
poverty.
are things, you know, raising the retirement age to 69 while still keeping early retirement possible at 62 is, I think, an issue that would close about a third of the gap. There are a number of things that could be done, raising slightly the tax rate, as Anirban said, raising the income limit. The point is, we've got to get and start doing this now. Unfortunately, both Trump and Harris have been going in the opposite directions in what they've been telling people that they would do, not even taxing the benefits.
If you say all that, you're not going to be elected, right? I mean, that's why it's the third rail.
So China is also grappling with this, as many other countries are. And
they just raised
today, they raised their retirement age from 60 to 63 for men and from 55 to 58 for women. But I want to talk about Medicare, the Medicare side of this question, because we've mostly been talking about Social Security. Let me give you a, shall we call it a concept of a plan. Medicare for all. The system right now is broken. Our healthcare system is broken. It's not just a crisis for how do we fund seniors. We have American families paying $1,400, $1,500 a month for health insurance, having no idea how much they're actually going to pay because we don't have any price, transparency when you are in an ambulance or on a hospital bed. You don't know exactly what things are going to cost, if it's going to be covered, so you're paying more later in premiums. We could fix this whole system. We were talking about it in 2016. Bernie was talking about it for a long time, and it's barely getting a blip of a mention, yet our healthcare system is still in crisis. Obamacare has done wonders for getting rid of the pre-existing condition limitations. It's done wonders for creating more options for health insurance, but it has not fundamentally fixed a broken system.
Jenny.
Well, so with these fine gentlemen, this is not my primary research expertise, but I think a lot about the value systems that are underlying these debates, right? The reason that we can't address some of these core issues in the country is because these diverse perspectives about how it is that we should engage government in supporting ordinary people's lives, right? And so you've got a constituency in the public that says that the government should stay out of our private lives and should not be involved in things like creating a safety net, that that's something that communities and church should do. And you have others who say that there should be an opportunity for everybody to live outside of poverty, to not have to be stressed about their access to health care And so that debate still is very fundamental, and with our very fractured Congress and their inability to even start a conversation to find some common ground with those two very disparate issues means that this is going to continue to be an ongoing challenge that has to get addressed at some point. My one concern is that what often comes out of these debates is small, incremental, tiny changes that don't really address the core problems. And so you end up sort of kicking these problems down the road another 10 years, another 10 years. That's not sustainable. And at some point, I think there really has to be a reckoning about these core value systems that we have.
Well, I just wanted to say I don't believe that anytime soon we're going to see Medicare for all. I think that is off the table. I think, though, that Obamacare has gone a long way to dealing with the problems with health care and people without insurance without, really starting from scratch, because that's what Medicare for all would require.